Hi, I'm Melissa, and this is London. She is a medical alert dog for my POTS, which is a heart-related condition. And I have 3 other dogs at home, so I do love animals. I work or volunteer for a rescue as well, but I'm here for my TMJ, which I've had since I was about 19 years old. And I struggled with headaches from it and just pain from eating to waking up in the day and just having lots of jaw pain to throbbing pain to from chewing, eating. My jaw locks and just would have pain in the jaw, clicking, all sorts of, just could get to the point where I couldn't eat. It would lock for 2 or 3 days at a time. Over the years, I've had some treatment in the military. They wanted to have surgery. I declined that and just went from no popcorn, no steak, no chewing gum, soft foods. Most recently, last 2 years, I had an arthrocentesis done and pain injections, which helped a little bit. And then through that process, I was referred here to physical therapy, which has been very, very helpful. From coming in the front door, the people at the desk have always say, hello, how can we help you? They're very quick to, recognize you when you come in, or how can we help? What do you need? Anything like that, or answer questions. As you don't have to wait very long for your appointment. When you are here, the staff that are helping you, whether it's an assistant or a therapist, they're very helpful or answer questions if you have them. It's very clean when you come in. I've not had any issues as far as that or concerns. The therapy has been great. I've had so many good results from it. As far as my jaw can open, it's increased a lot. And not having the same amount of pain that I was before. Since I've been in physical therapy, it hasn't locked on me at all, which has been amazing, because normally in the past it would have already locked multiple times, and it hasn't done that at all. Am I still in a little bit of pain? Yes. I think that'll be lifelong most likely, but it's a lot better. I'm not in excruciating pain daily. I can eat better. I can actually eat a hamburger, which is amazing. So it's been an amazing journey for me, and I look forward to continuing that journey. So right now, at this point, I'm kind of on that continuing path as far as making sure that my TMJ doesn't go backwards. And so I come in about once a month for therapy treatment and make sure I don't forget what I'm supposed to do, because as someone like me, I will forget what I'm doing. So I'd like to come in and just be reminded of the stretches I need to do, make sure that I'm getting checked to make sure I am continuing that. And then also get a little bit additional treatment of stretches and some other treatments that he does to make sure that things are moving and where they're supposed to be. And also remind me that I'm supposed to be doing what I do so that my jaw doesn't revert back to where it was many months ago when I first started. So. This is my first time doing physical therapy for TMJ. I've been to physical therapists before for other things, never for my TMJ, but I do think that when you see a physical therapist that knows what they're talking about and is a specialist in that subject, such as TMJ, like Dr. Matt is, you're going to get someone who knows what they're doing, knows what they're talking about. Just going to any physical therapist who maybe works great with knees or great with legs is one thing, but going to someone who knows about TMJ and knows how to do the stretches, the specific things related to TMJ is going to make your TMJ better. So if you're looking for a physical therapist for TMJ, come find Dr. Matt. I think you won't be disappointed with your outcome.
The program that you had, because you asked me, you said, please, don't give up on 2 or 3 weeks. Go at least 8 or 10, and I was in 100%, and that's I would strongly recommend that, absolutely.
Well, good to see you guys. I'm here with Gwen, one of my guests. She has been coming here for some jaw pain. So, Gwen, tell us a little bit about how you found out about us.
Okay. My dentist, Dr. Gost here in Cape Coral, recommended you because I was having jaw pain. And, excuse me, I've had a lot of dental implants, a lot of dental work in the last couple of years. And it just seems to have affected negatively my head, my neck, even fuzziness sometimes with thinking, and but mostly severe headaches since I had 2 titanium implants put in. So, and then I had those taken out and had a lot of force put on my jaw to take them out. And since then I've had clicking and just more tension in my neck, the front and the back.
So let's talk a little bit about how the physical therapy's been. Is it what you expected? What kind of results are you experiencing?
Well, I actually was expecting a PT gym, physical therapy gym, with balls and equipment, and that I'd be given some exercises and some stretches, and excuse me, that I would be shown initially what to do, and then I'd be kind of on my own to do them while they went to see someone else. And I was pleasantly surprised because we had the evaluation and between you and I, and then you started immediately to do some hands-on therapy. And I have to emphasize that the therapy that you do, Dr. Matt, is different than other physical therapy that I've had. I've had some manipulation or hands-on, but you, with your knowledge of cranial sacral work, from the top of the head to the bottom of the spine, really gives you an advantage. And I say that as an occupational therapist too. As an occupational therapist, I've worked with physical therapists and in a lot of settings, and I know good therapy when I see it. So.
Well, good. It's good to be with you guys today. I have Paula here, who is one of our TMJ jaw patients. So Paula, tell us about some of the symptoms you've been having and kind of your journey, how you got to us.
So I've been a TMJ sufferer for years and years and years, and I realized I was told by an oral surgeon that physical therapy could help me rather than him doing surgery on my jaw. So I'm originally from Ohio, and that's where I first experienced physical therapy for my TMJ, and it helped tremendously. But TMJ is something that's not just cured, it's a lifelong thing. And sometimes I do things that I shouldn't that exacerbate it and bring it back. I originally came to Allied Physical Therapy for another symptom I was having, pelvic floor treatment therapy, which was great. And then I realized on your board that you, Dr. Harkness, are a TMJ specialist. And I kept that in the back of my mind, and lo and behold, I had an episode, my TMJ flared up. So I got a referral from my doctor, came here, it was so easy, it was smoothless, it was seamless, got right in, you evaluated me, and we've had a great relationship getting this back in line.
Good, Paul. Well, let's talk a little bit about, for those patients that are watching, what is it like? What's the treatment like? And what should they expect? And a little bit of, what to expect in terms of getting some relief.
So TMJ, as people that suffer from it, they know that it's very painful. And relief comes from working not only in my jaw, but my neck and my shoulder, because my left side is the one that's affected. And we have discovered, Dr. Harkness and I, that it's a team effort. The better I relax and the more comfortable I am, which he makes me, the better treatment I have. And it's just been, everything from the clicking to not opening my mouth fully, not being able to speak correctly because it was so painful. And now, as you can see, I can smile and there's no clicking and there's no pain. And it's just, it's been such a blessing.
Talk about some of the things you've learned that you're doing on a daily basis, maybe that you weren't doing before, that's helping you to keep functioning and doing the things that you love.
One of the things that I learned is to brush my muscles, and I do that religiously. Whether it's we call it double chin, I do my open and close, I do things with popsicle sticks. I'm constantly like twisting my neck, doing neck exercises. I'm in the pool. I have tools now to help me and not just go back to bad habits and sometimes do bad things to my jaw because of my habits. The way I sit, everything affects TMJ. So I'm very now self-aware of what I can do to help myself.
So what would you say to someone that maybe has some jaw pain and it's clicking and they're not sure, should I come? What would you say to that person in terms of encouraging them to come?
Do it. It is seamless. It's virtually pain-free because you're not doing anything, medically with medicine and anything like that. It's just more hands-on, and it's relief. It's immediate relief. It's not a sprint. It's a marathon when you're treating something like this. And if you're suffering at all, get a referral and come. Yeah.
All right, thank you guys. Look forward to seeing you. I am happy to work with you, guide you on this process, getting able to talk, chew food, not have fear that it's going to lock up. So simply go to the website listed here, give us a call, and we look forward to getting you back to what you love.